welcome back. My name is Michael Miedema, Director of the Nolan Family Center for Cardiovascular Health at the Minneapolis Heart Institute Foundation. As we continue our series on cholesterol, we will look at the medications available to treat your cholesterol. Quite often, patients are quite hesitant to start a cholesterol-lowering medication. However, we do often recommend that they at least consider starting a cholesterol-lowering statin. Statins are a class of medications that reduce the amount of cholesterol made by the liver. And as we've covered previously, this is where the majority of your cholesterol comes from, and something that diet and exercise only modestly influence. With the newer statins, we typically see LDL reductions ranging from 30 to 60% depending on the dose and the patient. These medications are generic now and therefore relatively inexpensive. And most importantly, the trials studying these statins have shown significant reductions in heart attacks and strokes. And that is the whole point. You shouldn't take a cholesterol pill simply to lower your cholesterol. You should take one to lower your risk for cardiovascular events. Now, most patients I see are not worried about whether or not statins work. They are understandably concerned about safety. And to be clear, so am I. Providers have no desire to give their patients anything that does them harm. So that brings us to our next question. Importantly, we never want this to be a trade-off. If we lower your cholesterol, but do your body harm in some way, that doesn't make any sense. We only want to lower your cholesterol if we can do it safely. So this is where the science is really important. There are lots of anecdotal stories about the potential toxic effects of statins. However, in many large randomized trials where half of the participants are getting a statin and half are getting a placebo pill, the rates of side effects are actually very similar between the two groups. For the newer statins, based on these multiple studies, we can say with good confidence that the rate of true side effects is around 1%. So 1 in 100 patients started on a statin will have side effects, most commonly muscle pain or cramping. In those situations, the medication should be stopped and the side effects should go away. While studies show the risk of statin side effects is low, we still have many patients in clinic that clearly feel worse when they are on a statin. This is obviously very important from a quality of life standpoint. There have been several recent research studies evaluating the exact cause of statin side effects, and they conclusively have shown that the majority are not necessarily related to the statin. Now, just to be clear, I think some patients hear that and they think that we are dismissing their side effects as not being real, but that is not the case at all. So while we recognize that these side effects are very real, it's just a question of exactly what is causing them, and the science indicates they are not often directly related to the statin. In the past decade, several non-statin options have been developed that are safe and effective for the treatment of cholesterol. Ezetimibe, which had the brand name of Zetia, is a once-a-day pill that works in the intestine to block cholesterol absorption. Studies have shown that ezetimibe reduces the risk for heart attack and stroke with no evidence of significant side effects. The medication is now generic, so it's relatively inexpensive. When used alone, it typically reduces LDL cholesterol by about 20% compared to 30 to 60% with a statin. It is also very effective when used in combination with a low-dose statin. There is a new class of medications that block a protein in the liver called PCSK9. When this protein is blocked, the liver makes more LDL cholesterol receptors that then clear more LDL cholesterol from the blood. These medications come in a pre-filled pen that the patient self-injects every 2 weeks. They are very effective at lowering cholesterol. They can be used alone or in combination with other lipid-lowering medications. These medications have a very low risk of side effects but are not yet generic and therefore can be expensive. There are 2 other recently approved medications that are effective at reducing cholesterol. Both are associated with a low risk of side effects but can be costly. Bempedoic acid is a medication that acts in the same pathway as statins but does not appear to have the same potential for statin-associated side effects. There is a recent trial which shows this medication does reduce the risk for cardiovascular events. Inclisiran is a PCSK9 inhibitor with a unique mechanism of action, allowing it to be given as an injection once every 6 months. We have many patients that are interested in natural options to lower their cholesterol. We do have evidence that red yeast rice, which is a low-dose statin, as well as plant stanol and sterol supplements and soluble fiber supplements can provide modest reductions in cholesterol. However, we do not have any evidence that these supplements actually reduce the risk for heart attack and stroke. Additionally, dietary supplements are not regulated, which raises concern about their quality and safety. The consensus amongst cardiologists is that if a patient is at enough risk to warrant treatment of their cholesterol, taking a well-proven medication is the best option. Thank you for your time. I hope you found these videos on cholesterol helpful. Here at the Nolan Family Center for Cardiovascular Health at the Minneapolis Heart Institute Foundation, education is a core part of our mission. I encourage you to share this series with your family and friends and anyone you think can benefit from this information. Thanks again and stay heart healthy.